If you've been diagnosed with FAI or labral tears or just overall hip impingement, this is one exercise that may alleviate that pain. Dr. Nicholas Mercer with You Improve PT. So if you've read anything about me on youimprovept.com or know anything about my history, I have a long history with hip pain, FAI, labral tears. I've had surgeries on both hips. The surgeries actually made my hips worse, and I spent years and years going to PT school, learning everything that I could on my own to figure out what made my hips feel better, and I'm ultimately in a place where my hips don't bother me anymore. And I want the same for everyone else. So if you're having this FAI, labral tear, hip impingement, pain symptoms, especially when you're squatting, when you're just walking, when you're doing the activities that you love, it could be due to some restrictions in your posterior hip capsule, right? So when we go to flex, right, flex those hips like this, if that posterior hip capsule isn't able to allow that femur to move back, everything in the front of the hip is going to start to run into each other, right? So we're basically, the posterior hip capsule back here, that femur isn't able to come back as we flex, and so it stays in the front, and your innominate, your pelvic bone here, which is basically the socket for your hip joint, for your femur, comes in, and that all pinches everything together because that femur isn't moving back, so you feel it all in the front here, right? That's pretty typical of this kind of FAI hip impingement diagnosis, but there's a lot of factors that go into this, but one exercise I found that has really helped my patients with hip impingement and me personally is a self-mobilization for posterior capsule, basically stretching the posterior hip capsule. So very simple way to do this. On a lot of my patients, I will do it manually, and that's obviously going to be way better. But if you don't have access to that, or you don't have anyone who knows how to mobilize the posterior hip capsule, this is a pretty simple way and still effective way to get some relief from that and get that posterior hip capsule to be a little more mobile. So again, very simple. All you're going to do, we're going to start on the ground, and you're going to use your body weight as basically, the weight that the practitioner would put through you, and we're using the femur to push up through that posterior hip capsule and give it a stretch. So what we're going to do, line on all fours. We are going to, so we'll say we're working on my right hip. I'm going to bring that right hip to the center of my body, right, to the center line. Bring that left leg back, cross that right leg in just a little bit, lock in the heel here, so you see that shifts my weight back, and I'm going to put all of my weight through my knee here, right? And so from here, what you should feel is that femur trying to drive through, like that femur's trying to pop through your butt cheek. Enough stretch right on the top here, right? So obviously, like I said before, we're trying to get a stretch in the hip capsule, but you will get stretching in some of the posterior hip musculature, such as the piriformis, which is only going to be good, right? On a lot of people with FAI, hip impingement, they have this kind of piriformis restriction, and that posterior hip capsule gets really restricted too. So we're just trying to let all of that relax, push that femur through the back of the joint, and you'll actually hang out here for a couple minutes. And after those few minutes, we can do the other side. So again, we'll start on all fours. Now we'll bring that left side into the center, turn it out a little bit, bring the other leg back, lock it in. You'll see how that shifts my weight back. And we're just going to try to relax and let that gravity, the body weight, push the femur, the leg bone, up into the joint and stretch out all of that tissue back there. And whenever I do this, my hips always feel a lot better after, right? So we'll hang out there for a couple minutes. Then after that, we'll stand up, do a little retest, see how your hips feel here. See if you can feel kind of the femur pushing back now instead of staying in the front of the joint and getting all those symptoms. If that helped improve your hips, awesome. If not, and you're still having that anterior hip kind of restrictions, impingement, those FAI labral tear symptoms, there may be a lot more going on. You may need some more soft tissue mobilization. Got a lot more videos on kind of this hip pain situation on our YouTube channel, so check that out. Make sure you're subscribed to our YouTube channel to get more videos like this on a lot of different types of pain, but one of them, of course, obviously that's near and dear to my heart, is hip impingement and FAI and labral tears. So a lot of videos on that. But also check out our website, youimprovept.com. We have a lot of free information on finally ending hip pain and back pain and really any type of other pain that you may get. And this diagnosis does sometimes cause those other types of pain like lower back pain and knee pain just from the compensations you have to use. So check that out. Feel free to contact us through the website, youimprovept.com. Again, that link will be in the description below. And overall, we're just excited to help you improve your movement and improve your life.